Earlier we've spoken about complications of the cervix. All right, so a woman is pregnant and the cervix is not thick enough. Earlier on in pregnancy, the cervix needs to be thick. Okay, so if the cervix is thick, it will keep your baby up. But if your cervix is not really thick enough, all right, there's a risk of this baby initiating labor before the due date. Do you understand? So in the light of that, we spoke about cerclage, okay, cervical cerclage, stitching of the cervix and all of that. So the Shirodkar, okay, it's actually Shirodkar Stitch, is one of the ways in which you can basically stitch up the cervix. So what we said that it's a type of cervical cerclage. All right, it's a surgical procedure. It's used to prevent premature birth or late miscarriage. All right, so you want to actually stitch up the cervix so that you can increase, not really like stitch up completely, or just around it, just to increase the strength, so that you want the baby to stay up till 9 months. You understand? You don't want the baby coming out 7 months, 8 months before time. So it was first described by Dr. V. Shirodkar in 1955. It remains a valuable option, all right, especially when things like McDonald's stitch has failed. We'll talk about the McDonald's stitch. So purpose is to prevent the cervix from opening too early in pregnancy. It's used in women with a history of second trimester losses. Okay, you have lost a lot of babies in the second trimester. Okay, that's the second 3 months. Okay, from month 4 to month 6. All right, you always lose babies if your cervix is not strong enough. So it's surgical technique is through the vagina. All right, transvaginally. All right, dissection. Vaginal mucosa is dissected to expose the cervix. Suture placement is strong suture. All right, it's now passed through the cervix. All right, through the cervix, right, not just around it. Okay, pass part of it through the cervix too. All right, making it less exposed and potentially reducing infection risk. Closure. The knot is typically buried under the mucosa and incisions are closed. All right, just describing this. So advantages: higher placement near the internal OS for better support. There's reduced risk of suture exposure. All right, effective in cases of recurrent pregnancy loss. So a woman has been losing babies for over a long time. This is kind of like a very good solution for that. So considerations: technically demanding, is usually permanent. All right, often necessitates if the woman wants to give birth is through cesarean section. No, she can't use the cervix again because they stitched it. You understand? Okay. Removal may be complex. Okay, it's not suitable if membranes have ruptured or if there's an infection buried in. Okay, so that's just it for the Shirodkar stitch.